Blood pressure, the clinic scandal. They're doing it wrong. They say the error rate, 45%. Now, why is this important? Is it just important because the accuracy of blood pressure readings is only for information and it only affects your attitude about your health? Or is it important because it's the basis? These errors in reading blood pressure are the basis for prescribing medications, which, if aren't prescribed correctly, can do serious harm. And I contend they are doing serious harm to us, and I can use my own personal experience to back that up. How many of us are taking these medications that we don't need because of these clinical errors in actually taking the blood pressure reading? I'm going to read from this document. Studies consistently show that the medical community frequently performs blood pressure measurements suboptimally, leading to inaccuracies that can alter management decisions in 20 to 45% of cases. In one assessment of nearly 160 medical students, only one student performed all recommended measurement steps correctly. Wow. Are you taking blood pressure medication that you don't need? Are you showing as hypertensive when the high blood pressure reading came from improper measurement techniques? It's astounding how often that happened. And looking back at my experiences in both doctors' offices and clinics and hospitals, they never, not once, did it right. In my case, the diagnosis has been wrong 100% of the time. And yet most of my life, they had me taking high blood pressure medication, which left me feeling tired, worn out, because they were artificially lowering my blood pressure reading unnecessarily. The most common clinical errors: lack of rest. Guidelines require patients to sit quietly for 5 minutes before a measurement. When's the last time you were in a hospital or a doctor's office when they actually had you sit quietly? Usually they measure your blood pressure when you're in great pain, great distress, and nervous. Not good. Improper positioning. Arm position, hanging the arm at the side instead of supporting it at heart level, can falsely raise readings by 10 to 12 points. Unsupported back or feet. Sitting on an exam table without back support or feet dangling can also add 6 to 10 points. Cross legs. This simple mistake can increase systolic pressure by 15 points. How many times does that happen? The cuff over your clothing. Placing the cup over a sleeve rather than bare skin can add up to 50 points, depending on the thickness of the fabric. Yet how many times have they done that to me? Talking. Engaging in small talk or active listening during the procedure can add 10 points. Using the wrong cuff. Using a cuff that is too small for the patient's arm can overestimate systolic pressure by 10 to 15 points. Impact of these inaccuracies. And this is from the Lancet. The cumulative effect of these procedural shortcuts is significant. misdiagnosis, overtreatment. And here's the one that's near and dear to my heart, the white coat effect, the stress caused, the worry caused by the fear that your blood pressure is going to be high, creates enormous stress in a lot of people, and I'm a poster child for that. Up to 20 to 30% of high readings in a clinic are due to anxiety in the medical setting rather than actual hypertension. For this reason, I totally and completely discount any time other than at my home with my blood pressure cup, following the procedures that I know are correct. I totally discount any blood pressure reading that is taken in any kind of a medical setting, at a physical, in the emergency room. They're always high, and they always result in a prescription for blood pressure medication or beta blockers. I learned during my stroke recovery and the hospitalization that they filled me full of so much of this medication that when it came time to give me the pill and they took my blood pressure and looked at my heart rate, the nurse told me, "Well, I'm sorry, sir, but your pulse is too slow. We can't give you the beta blocker now." And I would say, I don't need the beta blocker. I refuse to take it. This is happening to too many of us, too many unprescribed medications. I suggest, and there are many videos on the subject, and it's one of the best I've seen is Ken Berry's video that talks about properly taking your blood pressure. And the key takeaways are this. Number one, take it at home at the same time each morning. Sit quietly for 5 to 10 minutes before you take it. Sit in an upright position in a chair with a back. Raise your arm, elevate your arm, and put it on a support in front of you equal to the height of your heart. Calm down. Calm down. Take multiple readings. I know my machine it takes 3 readings and then averages them. When I do it that way, my blood pressure is consistently 115/65 to 70. It has been for years. Yet every time I go into the doctor's office or a hospital, they immediately want to fill me full of blood pressure medicine. They tell me it's dangerous. It's 180/110 or something like that. I tell them, go away. Take the automatic machine away. Let me sit quietly for 10 minutes. Come back with a sphygmomanometer, a manual blood pressure cuff, and a stethoscope. Dig deep into your memory of medical school where they taught you how to take a blood pressure and take my blood pressure. And without fail, inevitably, every time they do that, my blood pressure is indeed normal. This is a warning. Before you grab that prescription and head off to the drugstore, start taking BP meds that you don't need for the rest of your life, doing God knows what to you. Make sure that the basis of whatever diagnosis that you get was done properly. It's important, and I think this is something that is worth repeating and can't be thought about too often if we're trying to monitor and maintain our own care and treatment. That's my message for today. As usual, my friends, take the rest of the day off and eat meat.